Namaste. Welcome to this episode of Beyond, that is, What's Up in Oncology. I am Dr. Akanksha Chabra, Consultant Medical Oncology at DMCH and AOI, Ludhiana, Punjab. And with me today is Dr. Supreeth, who is the Consultant Medical Oncology at Sri Shankar Hospital, Bangalore. That is the buzz of today, the Russian vaccine. So let us start with the episode. So, Dr. Supreeth, how are you today?
Hi, Akanksha, I'm good. How are you?
All good. So
I
I think
heard there is
without
a lot
wasting
of.
any time, I have a very interesting thing and case to share.
Yeah, please go ahead.
What happened with me? There was a patient with me who was a diagnosed case of cancer, and I was about to start the treatment for her. And all of a sudden, I saw a very anxious look on her husband's face. And I asked him, "What happened to you?" He said, "Ma'am, I want to ask you something." I said, "Please go ahead." He asked me a very pertinent question. He asked me, "Ma'am, now my wife is diagnosed with cancer. Is there any vaccine that we can give her to cure cancer?" So I said, "No, there is no such vaccine." And then he asked me again, a very pertinent question, that is, "Ma'am, what about this Russian vaccine?" So, Dr. Supreet, how do you take it?
So this is one of the common questions that I have also been experiencing from the patients of late, especially ever since this Russian cancer vaccine news has created a buzz in the Indian media. So what I answer to the relatives is that the Russian vaccine, one, is not scientifically proven, or their data is not out in the public. Usually, whatever medicines that we use, their data, the clinical trial details, the publication will be out in the public, and that will be incorporated into guidelines, and then it comes into our practice. But unfortunately, whatever data that comes out of Russia doesn't have any transparency. Because of that, we are very skeptical in using these drugs. And secondly, when you talk about vaccine, the Russian vaccine is not a molecule that is used to prevent the cancer from coming to a patient, or prevent cancer or treat the cancer or cure the cancer forever. So it is basically an extract from the patient's own DNA or tumor tissue, and that is exposed to immune cells which are genetically engineered, and they are infused back into the patient to kill the patient's cancer. So it is basically patient's own immunity which is fighting the cancer, and that is primed by using the tumor tissue.
So I also answered the same way. Basically, first I explained him that there's difference between the preventive vaccine and the vaccine which can cure. One is the preventive vaccine, which is used to prevent the cancer when the cancer is not already there. For example, we give it for cervix, we give it for like the HPV vaccine, which we talk about. And another vaccine is which can cure. That is when the cancer is already there, we give that vaccine to train our immune system to fight against the cancer cells and kill the cancer cells which are already present in the body. Russian vaccine that is not approved, and also this Russian vaccine is by the same group that had been discovered, that has discovered the Sputnik vaccine for the COVID-19. And but as of now, we are not using Russian vaccine, and of lately we don't have any data which has shown that the vaccine is effective when the cancer is already there. So we are not using it. And also, I think in the near future, also, we are not going to use it. So, yes, this is how I
Correct.
explain to
And
my.
and also any new innovation that comes in cancer, one, it has to go through a few regulatory approvals through Food and Drug Administration of the USA, and also by the DCGI of India. I don't think Russian vaccine has been approved for any of these by any of these regulatory agents. So I don't think it would come into our clinical practice anytime going ahead.
There is no to any Russian vaccine, so we do not use in our patients. And even in near future, also, I do not promise that we would be using it. So, yes, it's definitely no, so that we are not using this sort of vaccine. So, this is all
Okay.
about Russian vaccine. So, that is all from our side. Thank you so much for watching this episode. Thank you so much.